Cervical microforaminotomy, an alternative to a cervical fusion. Let's talk about neck and arm pain caused by a herniated disc. First, a couple of simple definitions. The medical term for neck and arm pain caused by a herniated disc is cervical radiculopathy. The word radiculopathy is composed of two words with Latin origins. The word radix means root, and the word opathy means a disease of. A herniated disc puts pressure on the root of the nerve and causes pain everywhere the nerve travels. A herniated disc usually squeezes the nerve root as it tries to leave the spinal canal through a small bony tunnel called the neuroforamen. The word neuroforamen also has Latin origins. Neuro is the Latin word for nerve, and foramen is the Latin word for an opening. Okay. Now that we understand those two terms, let's look at an MRI scan of the cervical spine. Between each of these bones are the intervertebral discs. Here at the C5-6 level, there is a disc herniation. On this view, we can see how the disc is bulging out towards the spinal cord and the nerve roots. And when we switch to a cross-section, called the axial view, we can see how the disc bulge is off to one side, and putting pressure on the nerve root as it travels through the neuroforamen. The location of the pain is a clue as to which nerve root is being affected. The cervical nerve roots travel to particular parts of the arm and the hand. We have our patients complete a pain diagram and a pain journal, and this helps us confirm which nerve root is irritated and inflamed by the herniated disc. When the symptoms of a cervical radiculopathy do not get better with non-operative treatment that includes physical therapy and anti-inflammatory medications, most patients realize that they may need a surgical solution for their pain. They need the pressure to be taken off the nerve root so that the pain will stop. The standard operation for a herniated cervical disc is something called an anterior cervical discectomy and fusion. This is a surgical procedure that removes the damaged intervertebral disc and replaces it with a spacer and titanium plate, stabilizing that level. This operation reliably alleviates the pain from a herniated disc, but unfortunately, fusing one level in the cervical spine increases the mechanical stress on the adjacent levels in the cervical spine and accelerates the natural degenerative process that occurs with age. This can lead to a loss of range of motion, more pain, and more surgery in the future. The results of cervical fusion surgery can be very good, but many younger patients who are athletically active would really like to avoid a fusion. There is an excellent operation for this problem that completely avoids a fusion. This operation is called an anterior cervical microforaminotomy. It has an excellent track record in the medical literature. In fact, the former head of neurosurgery at the University of California in Los Angeles remarked in one of his papers that, quote, patients treated with the anterior cervical neural foraminotomy procedure have equivalent or better outcomes than those who undergo current cervical procedures. It appears to be a good procedure for carefully selected patients with one-sided cervical radiculopathy, and avoids a fusion of the disc space. Here are the before and after MRI images of the spine, demonstrating removal of the herniated disc with an increase in the size of the neuroforamen. After this procedure, the patient can return to normal activities within 2 weeks. We advise patients to avoid sports such as mountain biking, horseback riding, and surfing for 6 weeks. But after everything has healed, we expect all of our patients to have normal range of motion of the neck and no activity restrictions. At the Minimus Institute in Monterey, California, we want to see all of our patients free from pain and able to return to the activities that they love. If you are interested in a cervical microforaminotomy or alternatives to fusion surgery, contact our concierge and we will arrange to have your MRI scan reviewed by one of our surgeons.